The only Level 1 trauma center for Miami-Dade County, serving thousands of patients a year. Jackson Memorial Hospital's Ryder Trauma Center, South Florida's best choice.
The best trauma surgeons want to work in the best trauma centers. We have 17 people who have committed their lives to trauma surgery. Nobody else can say that.
Ryder Trauma Center makes patient care priority one.
Our mortality rates are excellent. Our readmission rates are the lowest in the state for trauma centers, so we get it right the first time.
Our burn center is recognized by the American Burn Association.
We are the only one in South Florida. There are only 3 in the entire state of Florida.
A training destination for the United States Army.
Every single forward surgical team that's been deployed to Iraq or Afghanistan came to Jackson first. They come to us because we have the infrastructure, the volume, the expertise, and we are a model for trauma care.
And a model for quality care, covering South Florida, South America, and the Caribbean.
The Ryder Trauma Center is not just a hospital where you get taken care of after your injury. It's part of a system that starts with the call to 911 and ends with your rehabilitation.
3 a.m. in Miami, and a quiet night at the Ryder Trauma Center is about to turn busy.
Apparently we're getting somebody who was shot multiple times, and we don't know where all the injuries are.
Ryder averages just under 1,000 stabbing and shooting victims a year, which is why doctors refer to the trauma center as the knife and gun club. At Ryder, they are known as frequent flyers, and tonight's victim just became a member. This was his second trip to Ryder with a gunshot wound. Although it's difficult to estimate, hospital officials believe that every gunshot victim cost the hospital at least $46,327 in medical bills. Costs that are almost always absorbed by the taxpayers of Miami-Dade County.
Knife and gun club people, they don't carry insurance.
And then there are the innocent bystanders. Both Zackerson and O'Connell were on duty when the youngest shooting victim of 2012 came through the doors. A victim so young, she hadn't even been born yet.
We had a young woman who was 27 years old who came in who was shot. She was also 8 months pregnant. She was actually shot through her uterus, so her unborn daughter actually was shot.
Right now, all we know is it was a motorcycle accident. Patient lost consciousness at the scene, has a low GCS, so we're suspecting a possible head injury.
They train for tragedy. This Army medical team is at the Ryder Trauma Center in Miami, learning how to save lives in chaos. 10 forward surgical teams go through Ryder every year.
What makes this facility unique for training purposes is the highly penetrating trauma they receive. Those are patients with gun and knife wounds.
The Army chose the Ryder Center at Miami's Jackson Memorial Hospital because of the number of serious trauma patients treated there, almost 4,000 a year.